Yes, students. So this is Dr. Karthikeyan from Ardent MDS. So today we are going to see about the recently happened NEET MDS 2026 exam. Endo paper we are going to discuss in detail. Okay, right. Let's go for the first question, students. We're talking about according to the English classification, avulsion of teeth is belongs to which type of classification? That is what they're asking. It's so easy question. Everybody studied English classification in your third year, final year, and CRRA time. So it is usually the avulsion is yes, class 5. Root fracture is class 6. Right. So coming to the second question, radix paramolaris. There is something called as radix paramolaris and radix entomolaris. Right. So what is this radix paramolaris and entomolaris? These are some extra root in the mandibular molar. That extra root is present in the mesiobuccal side. It is called as radix paramolaris. If it is present opposite, which is distolingually, then it is called as the entomolaris. Yes, students, very good. The third question, it is a very new question. The canal configuration that has presence of multiple accessory canal. Actually, it is an image-based question. So how the question is almost they given you so many branches in the apical part of the canal. Okay, so there are a lot of branches. Okay, right. So like that, they given you a lot of branches. So it's usually this is called as a delta system. What is delta? Usually we studied in your endo part. So when you're talking about the root canal is actually constricted here and then slightly diverged. So this is we call it as minor diameter, and this is called as major diameter. Right. So the distance between the minor diameter and major diameter is called as the apical delta. So usually this apical delta has so many branches like this. Right. So this is based upon this is called as the delta system. Right. So question number 4. All of the following are the principles followed in the periapical surgery, which is not a principle. Actually, it is a controversial question, but good question. Right. Let's go for one by one, students. So horizontal incision given in the gingival sulcus for periodontally compromised teeth. Yes. So is it correct? Actually, it is not correct. Okay. Yes. So vertical incisions are placed obtuse angle to the horizontal incision. Yes, usually it is a correct. So most of the textbooks still follow the system which is given in the principles are of a periapical surgery. Okay, very rarely, okay, usually in a clinically. So maybe some of them actually go for a vertical incision as a straight. But still, textbook says it is an obtuse angle. Yes, it is a correct actually. Okay, I will tell you why the A option is wrong in a later. So intraproximal gingiva should be preserved. Yes, obviously it is for aesthetic reason, and also for that it is an anchor tissue for the suture placement. Yes, it is a correct. For a mandibular incisor, vertical incision is indicated. Yes, this is also a correct statement. Why first option is not correct? Okay, usually, for a periodontally compromised teeth, we won't give the horizontal incision along the gingival sulcus. So instead of, we'll be go for something called as Leuvecoxine bind flap. Leuvecoxine bind flap is something you given the incision submarginally, something like this. Okay. So this is actually away from the gingival sulcus. So it is not correct. So that is why I go for option A here for this particular question. Right. So question number 5, students. So question number 5, there is a question which this is very important. These type of questions, the age is very important. 7-year-old child pulp is exposed in the permanent molar. The itself given whether it is a primary molar or permanent molar. A pulpotomy is performed. What is the material of choice? Yes. So after you done the pulpotomy, whether you go for a pharmacrystal, yes. But pharmacrystal, which is used primarily for the deciduous teeth, not for the permanent teeth. Okay, but what are the remaining option? Then I can go for GAC or zinc oxygenol or calcium hydroxide. Preferably for a permanent molar, MTA is preferable. MTA is preferable. Biodentin is preferable. This type of materials are preferable for the pulpotomy in permanent teeth. But since MTA and biodentin is not there, the next preferable option for this particular question is calcium hydroxide. Yes, so option A. Right. Question number 6. Again, it is a little logical question. In a high-speed handpiece, which of the following increases the cutting efficiency? So obviously, when you give more pressure, cutting efficiency will be increased. Yes, we'll keep this. Okay, and type of coolant anyway does not determine the cutting efficiency. Pain threshold does not increase the cutting efficiency. So sharpness and rotation speed, obviously, which will be the better option among these two? So if the sharpness is good, means cutting efficiency obviously good. Suppose if it is a blunt, obviously cutting efficiency will be decreased. Straightforward question. So rotation speed and sharpness, which determines the cutting efficiency of the burr, right? So question number 7. So what is the question they are talking about? They're talking about something called as the non-vital teeth student, and it is an open apex. There are two important points here, two key points. So if it is an open apex and if it is a non-vital, usually for a non-vital cases, open apex, what is the treatment of choice? Apexification. So what is the question they say here about apical barrier before the obturation? It is a very important key point. So when you place a calcium hydroxide, so for the apexification, this usually create a barrier, apical barrier, so that the obturation you can do better. But what is called apexogenesis? Apexogenesis is vital. Okay. So apexogenesis is usually you just create the remaining root formation, right? If this is an open apex, apexogenesis, the remaining root is formed well, right? This is how apexogenesis and apexification differ. Apexification is creating a calcified barrier. Apexogenesis is creating a normal root structure. Right. So coming to the next question. Okay, there is a soft and fluctuant swelling is present in the necrotic mandibular molar. And along with an endodontic treatment, what should be done? Yes. So what is the key point here, student? The key point is about the soft and fluctuant swelling. Already there is a swelling, right? So why we should go for indirect pulp capping? Okay, this is not at all related to this question. Indirect pulp capping usually indicated when the cavity depth is too deep and it is close to the pulp, we go for a indirect pulp capping. So it is not related to this question. Okay, and so prescribing desensitivity toothpaste is also not related to the question. So pulp testing after 7 to 10 days, no. So it is an eliminating type of question. Since the patient has swelling, obviously, what is the primary treatment? The primary treatment is incision and drainage. Yes, sir. Right. Question number 9. So there is a traumatic injury which has happened. So there is a traumatic injury. After traumatic injury, the root surface is having a jagged margin, that means irregular margin, and with a radiolucent area. Since it is a radiolucent, I can eliminate the sealer because most of the sealer what we are using today is radio opaque, right? And whether it is a dentinal caries, obviously no. So what is the key point here after the traumatic injury? Yes. So root surface. Since they're talking about root surface, the answer is external root resorption. Internal root resorption usually starts from the pulp and it go periphery. Since it is happening on the root surface, so we go for the external root resorption. Right. So go for a question number 10. So is the calcium hydroxide placed inside the root canal by what type of instrument? That is the question. So usually there is an obturating instrument called as lentulospiral. It is a rotary instrument. The rotary instrument purpose is to apply the sealer inside the root canal. So it is again a straightforward question, students. So answer is lentulospiral. Right. Other K file, H file, everything which is used for the shaping of the root canal. Right. What is the correct order of the zones in fish concept in the periradicular area? So this question is maybe you prepared for your Viva third year, final year, multiple times in your BDS time, right? So the fish concept usually present in the periapical area. So you have the 4 zone, which is called zone of infection, is the first zone, zone of contamination, zone of irritation, zone of stimulation. So infection, contamination, irritation, stimulation, and probably this is a very important question. Okay, each zone which contain what type of cells. So that also commonly asked question. Right. So coming to the question number 12. Okay, which are the following is the natural scaffold in the regenerative endodontics? Usually, regenerative endodontics is a topic which is commonly asked for the last few years. The scaffold used in a regenerative endodontics are there are 2 types. One which is the natural scaffold as asked in this question. The other one which is called as the synthetic. So let's go for the polylactic acid. Is the synthetic. Polylactic glycolic acid is also the synthetic. Polyglycolic acid is also the synthetic. But what about hyaluronic acid? Hyaluronic acid, PRP, platelet rich plasma, platelet rich fibrin, and GAG, glycosaminoglycans. All these are natural scaffolds. Okay, can be asked in your 2027 exam also. Right. So 13th question, an 8-year-old child got Ellis class 2 fracture. There are two questions which came from the Ellis class 2 fracture student this time. So how do you treat this? So usually the Ellis class 1 and class 2 fracture are called as, okay, simple fractures, or you can say uncomplicated fractures. Mean the pulp is not involved. For the aesthetic reason, both for a class 1 and a class 2 fracture will be given the composite restoration, do the shade selection properly. Okay, and so we'll go for the composite restoration. Again, it is a straightforward question. We won't go for a stainless steel crown or zirconia crown, just for an Ellis class 2 fracture. Yes, question number 14. During the chemomechanical preparation for the root canal or the biomechanical preparation of the root canal, which part of the tooth is considered as the danger zone? Okay, so let's explaining the danger zone, students. So this is actually what is called as the danger zone. Okay, so this is the outer surface of the root. Okay, and the inner surface, which I'm drawing in the pink color, which is called as the inner surface of the root canal, especially curved root canal. So the pink color, where is this area? The dentin thickness is very less comparatively. Okay, to the outer, the dentin thickness is very less. So that is why this the inner part is called as the danger zone, students. The inner part is called as the danger zone, right? So answer for this question is the inner part, inner curvature. Inner curvature of the curved root canal, where the dentin thickness is very less, usually considered as the danger zone, right? So coming to the question number 15. This question is asking about mandibular molar, which got an irreversible pulpitis. Okay, right. Which are the following anesthetic technique is used to give the profound anesthesia? This is actually one important key point here. Okay. So whether I can go for topical, obviously no, not at all. Infiltration doesn't work for mandibular molar. Yes. I can go for either C or D. So C is a inferior alveolar nerve block. Okay. D says inferior nerve block with the intraligamentary injection. Usually for a irreversible pulpitis, the anesthesia effect will take some time. Okay. So that is the reason usually for a irreversible pulpitis, we go for an accessory injection technique like intraligamentary injection also. So D is better than C. D is better than C, right? So last question. So there is a child who got avulsed teeth 20 minutes back of the maxillary central incisor. What is the treatment of choice? It is a beautiful question. Okay. So very tricky question said by the examiner. So the child ages, whenever this type of question is asked, the age is very important. Second, you have to check about whether it is a primary teeth or permanent teeth. All this type of question is a very, very important. Okay. So it is a step-by-step process. Okay, primary or permanent. You have to see very careful. Okay. And any trauma type of question from the endo, you have to see three things. If suppose if this is related to the pulpal exposure, you can add the third point. That means what? Open apex or closed apex. So these are the 3 points which you should take care. Right. So since it is not related to the pulp, since it is related to the avulsion, at least you have to see this. Okay. So second point, and related to the avulsion, the third point, which is very important. So when the patient brings the avulsed teeth, within how much time the patient is bringing the avulsed teeth. This is very important in avulsed teeth management. So within 20 minutes, the patient is bringing the avulsed teeth. Yes. Good question. Good. So since the patient brings the avulsed teeth within 20 minutes, usually what you do, you just do the reimplantation. Okay. Very, very simple. Very simple. But this question is asking about 5-year-old child. 5-year-old child, the maxillary central incisor will be erupted permanent. No. So they're talking about primary teeth. Since they're talking about primary teeth, usually we do not reimplant. So answer is C, students. Right? So whether you have to go for a reimplant and perform RCT later. Okay. So it's not all these are related to the permanent teeth. Obviously, since it is a primary teeth, you won't go for the reimplant. So these are the questions. So which are asked in NEET 2026 Indo paper. So we'll just go for the remaining subject also, line by line, one by one, for the next 2 days. All the best. Take care.